TNT Open Mind Insights brings you powerful, authentic conversations, illuminating the path to better mental health care for all.
Pooja, Bhalla, you're the CEO of Illumination Foundation, what I consider one of the leading agencies and programs to help unhoused people here in Southern California. I've had the good fortune of knowing you for a few years now and having some involvement in the Illumination Foundation, and I've been excited. That's added a lot to, you know, uh, the kind of work I want to do, especially at this point in my career. Today, I'd like to spend a little bit of time just, learning more about your organization, what your vision is, how you've seen since you became the CEO to this point, where you have seen things, move forward. So maybe you can tell us a little bit about the Illumination Foundation.
Yeah, well, thank you first, Dr. Vera, for including me in this conversation. And really, it's been great, getting to know you and work with you. And really, as we try to tackle homeless population in Orange County and all throughout Southern California, it's been great to be part of the system here. So, Illumination Foundation serves the unhoused population in Southern California, and we provide integrated housing and healthcare services to the unhoused. And our model is street to home. So let me break that
Yeah.
down. So when you see someone out on the street, at the corner, at the bus stop, or sitting at a bench, you wonder what happens to that person. So many of those folks end up in the hospitals. Many end up, out being connected to outreach teams. So they will enter into our system of care, which again is street to home. They may come into one of our navigation centers, which is a shelter.
Okay.
And let me explain what a navigation center is. A shelter is usually when you're coming in at 3 o'clock in the afternoon, and then the next morning at 5 a.m., you're asked to leave. A navigation center is a place where you can come in, you're there, you can stay the whole day, and we start working with you to get you into permanent housing.
Mhm.
So you may see someone who comes in through a shelter. A big part of what we do is really focus on the healthcare aspect, which is my expertise. So I worked in Boston for 25 years. I was a CEO for Boston Healthcare for the Homeless program, which is the leading organization started back in 1985, where we were really trying to understand the needs of the homeless population. We were working on the streets. We started what's called a medical respite recuperative care program. And then I was introduced to Illumination Foundation at a national conference where I was on the board, where I was very um, involved in learning about how do we impact someone's health when it comes to someone who's unhoused. So Illumination Foundation cycle is to disrupt the cycle of homelessness. So someone may come in through the streets, then they get into a program called medical respite recuperative care, which is when they end up in the hospital. Say you have pneumonia, or you were just diagnosed with cancer, or you had a fracture, you go into the hospital, what's going to happen to you next? When someone is homeless, they don't have a place to go. Where do they end up going? They go back on the streets. So that's what recuperative care does. And we have 500 beds of
Right.
recuperative care. But the most unique thing about Illumination Foundation is that we do housing.
Okay.
And that's our street to home model. So come through a shelter, come through recuperative care, and then we move people into housing.
Okay. What was so impressive in what you just shared was it was over 25 years ago that you began this work in Boston. You know, myself having been in healthcare now almost 40 years, people come and go, and they're passionate about programs and they put a lot of time and energy, but then other opportunities arise. It sounds like you've stayed the same path. Let's go previous to those 25 years ago. What even, with a background in healthcare, my guess is you probably knew at an early age healthcare is, I want to do something. Why in the unhoused people that society often looks at, not with the same, energy, and we'll get into that in just a few minutes. But what was happening when you were younger that brought you into this area?
So I grew up in India. I was born in New Delhi, and my family immigrated to Boston, Massachusetts when I was 15 years old. And right when, I was younger, I always had the dream of becoming a physician.
Okay.
So when I moved to Massachusetts and went to high school there, things changed for me. Being an immigrant, parents that didn't work,
Right.
I had to really be on my own and
Okay.
get a job and figure out what I needed to do. And right around that time, I, remember visiting the hospital and visiting friends, who ended
Yeah.
up there for some kind of medical issue, and really witnessing the nurses and the doctors taking time to understand not just the health side, but the human side of the
Right.
person. So I
Yeah.
was really drawn to that. And then, as I moved forward in high school, I realized that medical school was a long journey for me, and financially, it was going to be a big strain for me. So I decided to switch. Like I'm going to go into nursing. I can graduate, I can do the stuff that I love, be with
Yeah.
patients, be part of medicine, be part of the healthcare field. So I joined nursing. And as part of my nursing rotation, we all had to do a community rotation.
Okay.
So my community rotation ended up being at Boston Healthcare for the Homeless program,
Okay.
where I met this wonderful street medicine doctor, Dr. Jim O'Connell.
Okay.
And I followed him around on the street medicine van to really understand, like, how do you actually practice medicine outside of a hospital? I was just fascinated.
You were at what age?
I was, so this was when I was almost 18 years
18
old,
years old. Yeah.
So I did my rotations, did some street medicine on the van, graduated from nursing school. I still was like, I'm still going to get my doctorate. That was
Yeah.
always the
Right.
goal. But when I met Jim O'Connell and when I went, in the middle of the night under bridges, it's
Right.
very cold in Boston. We used to see people sleeping under bridges, hiding, a lot of folks with mental health
Yeah.
that just did not understand that what they were doing outside was so dangerous, but they had voices that were talking to them. But the only place they could find peace was being outside, even though they were cold. So I saw that. And then as soon as I graduated from nursing school, it was a human connection that really drew me to working in, the homeless world. And I do remember, when I was talking to my advisor when I was about to graduate, she's like, well, what kind of nursing do you want to practice? And she's like, well, do you want to go to pediatrics, ICU, and that? I'm like, no, I want to work in the homeless population. And she asked me the same question, why? I'm like, I am just drawn to how beautiful it is to be having conversations with human beings who are not used to being treated as human
Yeah.
beings. And I remember those conversations sitting down with, a 35-year-old woman who had been living on the streets since she was 19 years old because she had been through a whole domestic violence situation. And her just having the opportunity to have someone listen to her and give her guidance and bring her into a shelter and make her feel safe really was like, wow, this is much more than what I thought I could do. And that's what drew me. And then back then in Boston, we didn't have a lot of programs. So I spent 20 years building a lot of programs with the rest of our team, on streets and shelters. And then here I am at
Yeah.
Illumination Foundation.
Again, as a parent of two boys, that I have to often like motivate. Okay, did you do this? Did you do? You were 18, 19, and you were self-motivating yourself. I mean, you were navigating an area that people would just shun. I, I wouldn't be surprised. Even your parents, are you sure that's where you want to be? Or
Well, maybe I can add to
yeah,
why that kind of happened.
yeah,
When I was coming from all the way from Delhi to
yeah,
Boston, it was a very different experience for me. I came from a community that I grew up in, and I came to a very, across the world.
right.
It was isolating, for
Okay.
the first few years. It was very
Yeah.
isolating. And I remember feeling not being part of the community because it was hard growing up, going to a brand new high school where I didn't know anybody. So when I saw those patients, when I saw those individuals and how they felt isolated from society and the feelings they were expressing to me, like, well, I don't know if anybody really cares for
Yeah.
me. I remember feeling that as a
Mhm.
16, 17-year-old when I was in high school because I didn't know anyone,
Yeah.
and English is my second language. I had to fit in. So I could relate to some of those feelings when I met my patients out in the streets because they just felt isolated and alienated. And I don't know, that's kind of how it started for me.
Yeah. Yeah, it's, hearing people's stories from the beginning, and just, you know, importance, like sentinel moments. Now, as you now bring, not so much fast forward, um, what are the changes that you've seen? Um, and I'll share in a few moments how I still see we struggle with unhoused, here, in the United States, about, programs to help and programs not to help. It's almost like we have one foot in, then we pull that foot out. Um, h- how has that journey been for you, as you've advocated for the people that need the most advocation?
So I'll go back to when the program was started in Boston. This is pre me. It was in 1985 where 13 cities around the country were given a grant
Okay.
to end homelessness. That was the charge given. So it was Boston, LA, New York, Chicago, all the big cities. It was a Robert Wood Johnson Foundation grant
Okay.
because the numbers back then were small for homelessness. And it's like, okay, here's a grant, fix the issue, and we're going to end homelessness. And I remember when I joined in 1997, the organization was about 12 years old in Boston. I think we had 44 staff members. I was like the fourth nurse, and they were nurse practitioners and site staff. And the numbers just kept growing. And soon after that is when the federal government took charge under HRSA,
Okay.
and homelessness was given a category of healthcare for the homeless movement.
Right.
That's when the programs really started to grow. And then Massachusetts very early on had adopted the Affordable Care Act.
Okay.
So we were able to really bring on more services and serve the homeless population. Numbers kept growing. And again, no surprise, and I'm sure we'll talk about this a little bit, is the reason you see more and more folks enter into homelessness is because they simply can't afford to rent. We cannot afford housing. Here in Orange County, to afford a one bedroom, it's $2,600 a month for a one bedroom apartment, which means a single mom with 3 kids has to work almost 70 hours a week to make ends meet. So the way it's evolved is there's been a lot of funding put towards homelessness. And the great news in California, I want to highlight this, is a new program called CalAIM, California Advancing and Innovating Medi-Cal, where Medi-Cal has really taken charge and addressing the social determinants of health. So, we talk about homelessness as a problem where people don't have a place to live. They don't have health care, they don't have housing, they don't have jobs, they don't have a community, they don't have good food. So CalAIM in California has really taken charge of that. So the way it's evolved, I would say, at least in the last 8 years that I've been here in California, is now the healthcare system is recognizing that the healthcare is not just the health issues, it's everything around the housing, the unemployment, the transportation, the food. So there's a lot of funding
Right.
for programs to keep people in housing, find them housing, get them healthy foods. Yet the system isn't set up in a way where we can keep people from falling into housing. So we're moving the needle a little bit, I would say, in trying to address the healthcare and the housing needs. Yet we have a long way to go because people are falling more and more into housing
So,
insecure.
some of what I just heard from your sharing that story, do you feel that it's not necessarily we need more funding, but we can use these monies more efficiently? We may be not using these, especially with your experience on the front line. We could always use, more money can maybe make us do more things, but we should be doing a better job with the monies that we have allocated to us.
Yes. So, for instance, there's a lot of funding for navigation centers, shelters,
right.
for services, for healthcare, for enhanced care management, for housing navigation. These are all the different benefits through Medi-Cal. We just need to coordinate them better. For instance, one of my clients has 5 different case managers that they're talking to. They have an enhanced care manager, then they have a housing navigator, then they have a case manager's recuperative care. So there's a lot of silos that are overlapping. So we really need to keep the client in the center and say, okay, and this is why our model, street to home, is we're going to get you all the way through the end. But the way the overall system is set up, there's too disjointed. There's no alignment. So I would, think that every person moving into shelter should have a rental subsidy so they move into housing.
Okay.
Yet that does not happen. For every 10 clients that are in shelter, maybe one would be attached to housing. So there's no way out of this system without really coordinating everything. And that's where we really need to be
Okay.
more efficient.
And my guess is you could, it's a strong word, guarantee these decision makers, give me an opportunity for the next year to sort of readjust what you're doing, and I will have a better outcome, less homelessness, and I'll save you money.
Yes.
You probably think of that every night.
Every night. And then I want to give you an example. So we got a award through the California Healthcare Foundation last year where they asked us to pilot a program to do exactly that. And my charge was every client coming into our recuperative care is going to move into housing. I said that was what I wrote the program about. So what we did was we got together with CalOptima Health, we got together with the county, and I said, these clients that are high utilizers at the hospital are coming to recuperative care. I can't put them back out because they're going to come right back.
Yeah.
So we were able to coordinate this pilot program where those clients were connected to a rental subsidy and I found them housing.
Yeah. Yeah.
And it's working. So I think so far we've housed 128 clients through
Okay.
that program. Yes, I think if there was an opportunity like that, we can connect the dots.
Yeah. What are the barriers that you're finding?
So a lot of it is the way the housing subsidies are given out.
Okay.
So let me explain that. You have to be chronically homeless to be connected to a voucher, a rental subsidy. That means you have to be homeless for a really long time to be connected to a voucher.
What's a really long time?
It's in a year you have to have certain number of hospitalizations and certain number of days.
Okay.
But let me tell you, like if I have a 59-year-old who's in recuperative care, has cancer, they should move into housing, yet they're not on that list yet because they have not met the criteria for chronic homelessness.
Yeah.
So if you're chronically homeless, you will most likely get connected to housing probably within a year. But if you haven't met that threshold, you're staying on that list 3, 4, 5 years to move into housing. And that's where the system needs to be relooked at. And in fact, I just had a conversation with someone last week. Like, we know the number of clients we have, we know the number of vouchers we have. How do we connect so the people who need it the most are people that are with us right now? Because there are other situations where someone may be waiting for their housing and we can't find them. That voucher goes to waste. We have to start all over again. So why not start off with folks that are already in shelters, that are already, they might not meet that checkbox of chronic homelessness, but they're there.
Yeah.
Let's connect them to housing. So that's kind of some of the red tape that we have to figure out.
Is someone listening?
Yeah, I mean, I think the federal government and, state agencies and county, all of them have to work together to look at those rules and see what can we waive, what do we want to keep, what can we do differently. There's rapid rehousing programs, there's emergency solutions grant money. There's like 9 different types of rental subsidies. Like, can we start all over again? Look at every different type and see which ones work for who.
It almost sounds, you want good preventative care. From day one of being unhoused, you want to start evaluating and intervening, not 6 months or 3 months. Do a day, because is it the longer somebody stays unhoused, the more difficult it gets to come back?
Well, the longer someone stays in house, they have more of a chance to find housing. But here's the thing, by then their health has declined. We may not be able to find them. They may not be able to find housing in the same community that they're from. So there's too many things that aren't making sense that we need to make sure, we've got someone, yes, they don't meet the chronically homeless definition, but they're sick. They're never going to work again. They need a stable place to be.
I'm just thinking the mental health burden at week 1 versus at 6 months out. I mean, how do you come out of 6 months of not knowing where you're going to sleep or safety.
I've had clients come in, who aren't able to sleep in a bed because they're not used to having a pillow or a blanket.
Yeah.
They'll say to me, I can't sleep here at night because it's too quiet, and I can't sleep in a bed because I'm not used to sleeping with a pillow. So those are the types of things, you're out on the streets, you're trying to stabilize yourself. I've had clients say to me, like, no one has called me by my name because I'm out there and no one really knows me. So the trauma that comes along with being out there, and then you're here trying to do all the right things, and then you start doing all the right things, but your time's up at recuperative care. Where are you going to go next? You're going to go back right on the street.
Yeah. You, I mean, I wouldn't call it wasted money, but if you haven't broken that, you put all these resources and they're going right back
Right
to
back
it.
to it.
I mean, how do you, what's your perception of society's receptiveness today at the end of 2024 in, addressing and supporting, people who want to help
Yeah.
unhoused? I mean, where is society
I
today?
think it has evolved. I remember when I started this many, many years ago, there was this perception that every homeless individual that you encounter, is involved in criminal activity or drug addiction. That is not what we see today.
Right.
Today, who I'm seeing is the single moms with little kids. We have 74-year-olds in our shelters right now that became homeless for the first time in their life. So those misconceptions about who's experiencing homelessness, they're not true. We are seeing folks who are actually in our shelters right now. We have people who are working. They just can't make ends meet, so they stay in our shelter for months and months so they can save first and last month's deposit.
Right.
So I see the society, I think, having a better understanding of who's experiencing homelessness. And I want to say, Orange County, I'm very grateful to the folks here because there's so many supporters here that have really come around to support and do the right work. For instance, we have 5 family emergency homes, and those are completely funded by supporters,
Right.
philanthropy, right?
Okay.
Because they believe that these folks, just like you and I, deserve a home to be. So I've seen the thinking evolve over the years where we want to be more community oriented. We want to help the people that need. I mean, how do you leave a 74-year-old out on the streets?
Right.
How do you let a mom, with 2 little ones sleep in her car? So I think that is changing, and the face of homelessness has changed.
Right. Yeah, I mean, that again, baby, everyone has the right to happiness. And how can you be happy in the truest sense if you don't have a place to live? I mean, we have an obligation, as a society to, bring it to the forefront. Again, having familiarity with Illumination Foundation, the work you do. There's so many organizations that work with homeless that are all doing do you all work together well? I mean, that's sometimes I know in healthcare with sometimes people don't always work well and communicate well and sort of work collaboratively, but how is that in
I
work
would say that's where we all need to be. And there's been a concerted effort, at least in Orange County. I'm seeing that there's a lot of partnership opportunities because no one entity can do it alone.
Right.
I think a while back when I first came 8 years ago, everybody was like, okay, we do this, we do that. There wasn't a lot of collaboration. I would say we've really come together as a county. There's so many wonderful partners, and we're all really trying to complement the work that we do together. So I think it's getting stronger, but we could
Okay.
always be better.
Year to year you feel it's going in the right direction?
It's definitely going in the right direction. The thing that's a little bit unique about California and specifically, the counties is we have the health plan, then we have the providers, and then we have the county, and then we have the cities. There's all these stakeholders that are involved. Like we have to go through all these processes to make a project happen. We have to make sure that our elected officials are on board, that our stakeholders all are rowing in the same direction. And that makes it harder. It slows things down.
Right.
But I think everyone's coming together and moving in the right direction.
Okay.
Mhm.
Now I give you props for that energy to, a new group comes on or new elected officials and in your mind you go, here we go again.
Mhm.
You know. That takes persistence. What would you like to share with us with, not just myself as a psychiatrist, but the people in the community of Orange County? What would you like us to do to help and support and try to do bring an end to people that don't have a home?
Yeah, I mean, I think we all know the burden of mental health on everybody today, and I think we see that in our clients as well. The unfortunate thing is our clients don't have access to mental health when they need it. And we know that's a bigger, larger issue for anybody, to get into a psychiatrist or a therapist. It's
Sure.
weeks out.
Yeah.
But for us as the community, as the homeless providers, there's even more of a challenge because of the benefits, which is Medi-Cal.
Right.
Our clients are all on Medi-Cal, so a reimbursement rate for a Medi-Cal provider is a lot different than someone who's in a private health insurance. So my patients, when they need therapy, when they need psychiatry, when they need addiction treatment, they have to wait months
Right.
and months and months. And the way we've seen this work for our population, if my client's ready to go into detox today, I need to get him in today.
Right.
Because tomorrow I may lose him. He may not come back and he may not want to do that. So what I'd want everyone to know is that there is a dire need for mental health in this space.
Right.
There's not many mental health clinicians that are working in the healthcare for the homeless space. I think we need a lot more clinicians trained in this. And I think having our primary care practitioners really focus on addressing mental health, which I know part of the TNT program does, is amazing. Because if you were to talk to our medical director right now, he would tell you, like, he can start addressing the healthcare needs, but if he can't address the mental health aspect of the client so he can take the medications, it's going to be very, very hard for him to address their hypertension and their asthma and their chronic diseases because he's having anxiety and depression that has gone untreated for years. So my ask would be we need more clinicians in this space and we need more faster treatment, addiction treatment, more trauma informed treatment for our clients.
Yeah. Again, as I was even thinking, even before that, your story of when you came from India and then, had the good fortune of this opportunity at a pivotal time in your life. What about, our youth and we hear more and more about, community service and all, and when our youth are becoming all over, social media and spending, if they could just as a ninth grader or a 10th grader, come and see a shelter, go on the street in a safe manner, naturally, I think they would get so much more about what's the meaning of life, the raw life,
Yeah.
that, and I think you're doing things like that, but that should be the norm.
Yep.
The people, every student, college students, I mean, every medical student, everyone in any kind of health program should actually, see somebody on the streets and the meaning of life.
Yeah. So when I was in Boston, I used to teach in
Right.
community health and public health nursing. And one of the very first exercises I did with my students when they would come in is I'm like, what's the first thing that comes to your mind when you see someone who's homeless? And every time I would hear like, well, that's someone who broke the law,
Right.
someone whose family disowned them
Yeah.
because they did terrible things.
Yeah.
That was the perception. And, from a very young age, when my kids were 7 and 8,
Yeah.
I brought them to the places that I worked at, during the holidays, during Thanksgiving, where they would come and get to just talk
Right.
to clients and hear their stories. But yeah, it has to start at that tender age where they can really experience, what someone has been through their entire life. And here you're at the age of 6 and 7, have so much privilege
Yeah.
to sit
Yeah.
there and listen to the stories. But yeah, I remember talking to the student who just didn't know even how to communicate with someone who was homeless because they just they were scared.
Yeah.
They
But
didn't think
my
that-
guess is probably within a half an hour to an hour, you just saw a
Yeah.
180-degree switch. What about the flip side? We have an epidemic of loneliness in this country. Our seniors are lonely. They're isolated. What about bringing our seniors
Yep.
to the front line? And we have an army of seniors that
Yep.
could, I don't know, maybe begin that social connection.
Yeah.
With
Yeah, that's the silver tsunami we're seeing. We're seeing a lot more seniors coming into homelessness. So what we created at Illumination Foundation are these senior micro communities where we have 5 or 6 of them sharing a house.
Right.
Each one of them get their own room,
Yeah.
yet there is that community.
Right.
Because one of the things we saw very early on around the country when we were addressing homelessness, we would move people into housing, but they would go into an apartment by themselves and they would die a few
Yeah.
months later because of social isolation and loneliness. Even though they were out on the streets, they always had a community around them. But once they moved into housing, they were totally by themselves.
Right.
And we really realized that, oh my God, we got to make sure we address that they don't stay alone,
Right.
that they have some sort of activity going on, they have someone checking up on them. So here at Illumination Foundation, we created the micro communities where
Okay.
the seniors all live together.
Okay.
One does the cooking, the other one takes out the trash, one manages the garden, and it really does create that community, and it's critical.
I was thinking a little bit in a different way. Our seniors that have intact housing that are now 70, 75, but still healthy, is there a way that they can help unhoused programs, like be it volunteering and so forth? Because that's the group that's lonely now
Yeah.
also. They're intact, they have housing, they have wealth, they have,
Yep.
we've got to, I would, if I was in that place, and once I retire or even forget to retire, that would bring so much meaning to
Yes.
me.
Yes.
Is there?
We have folks who volunteer. Yes,
Yeah.
we have folks in their 60s and 70s
Right.
who volunteer. They come, they play bingo with our
Right.
clients. They'll do art and crafts. Yes, absolutely.
Yeah.
I think, it really is about being in the community and being there.
We're a society that has risk management or rules and regulation. I would love those senior people to walk with your staff down the riverbed, and they're unlike a 17 or 18-year-old that's doing that. They've lived life.
Right.
They're not going to be fearful of seeing that person unhoused and just saying hi, how, and I can imagine their life experiences with having that unhoused person now feel comfortable with the human being. I could see them almost every other day
Yeah.
coming down and say, let's, yeah.
Yeah, we have a volunteer who comes in every
Yeah.
Tuesday. That's her thing. She comes, she spends time
Yeah.
in a recuperative care. She plays bingo, and that's her activity, and that's how she gets through her week.
Yeah.
That's her looking for
Have you asked her, what does she get out of this? What is,
that she gets
Yeah.
to be part of a community, because when she goes home, she's by herself, and her family comes to visit maybe around
Yeah.
the holidays, but this is one way of her coming and connecting with the rest of the world around her.
Where do you envision things, 5 years from now?
Yeah, so one of the big things, that really I'm focused on right now is how can we get more of our clients into housing? Because
Okay.
the number is very low because we don't have enough vouchers, we don't have enough housing units. But most importantly, I think for me personally is I know in Orange County we can end family homelessness.
Okay.
I don't think it's
We can
okay.
end.
We can end family because
Okay.
the numbers are small.
Okay.
300, 400 families, I think we can do it.
Okay.
Because it's not okay for a single mom with 2 kids to be living in her car. It's not okay for a single mom. So I really do think in Orange County, I hope we can end family homelessness. And I think we can in the next 5 years.
And imagine what a precedent that would be for the rest of the country. They ended it. What the 5th largest county in the country ended it.
Because we've done
Yeah.
that with veterans in some of the
Yeah.
cities, in some of the
We've ended
states,
it.
we've ended veteran homelessness.
Okay.
So I think we should really focus on family homelessness because that's where it starts, right? The trauma with the kids that are experiencing homelessness, their adulthood, they're going to be in trouble. And I've seen generational homelessness. I've seen grandmothers, parents, grandkids that have all experienced homelessness for years. So I think if we could really prioritize that, I think it'd be a great thing.
We'd be proud to be residents of Orange County. Well, thank you so much. This was, I learned a lot, and the people that will be viewing this video will sort of appreciate your experience.
Thank you.
Yeah,
Thank you for having me.
Sure.